Talk about lower eyelid surgery or a lower blepharoplasty. The ideal candidate for lower blepharoplasty surgery is somebody that's got some bag formation under here. Those bags, that puffiness, is what surgeons refer to as pseudo herniation of the fat pads. Believe it or not, your eyeball swims in a pool of fat, and those little fat pads, as we get older, or if it's just us genetically at a young age, can sit too far forward and become more obvious. Surgically, we can reduce the size of those fat bags by basically taking the fat out. The way we access those fat bags, so there's two ways to get to them. One is to make an incision in the conjunctiva, or pull the eyelid down and make an incision on the inside of the pink part of the eye. Alternatively, we can make a small incision right under your lashes on the skin. I trained doing both methods of incision, the skin and the pink part. I tend to prefer the pink part because there's a lower risk of ectropion, which is scarring down of the lower eyelid. So the most feared risk of lower eyelid blepharoplasty is ectropion, and that's where the eyelid permanently scars down like this. And that's problematic because then your tears don't drain appropriately. Also, cosmetically, it's not ideal. Risk of ectropion is slightly higher if the surgeon does a cut on the skin versus if they make an incision inside on the pink part. The main limitation of using a cut on the inside is that I can't remove any excess skin of the lower lid during surgery. Now, I tend to not like to remove a lot of skin anyways. One is because you're only removing just a tiny bit of the skin and you're not actually addressing the whole area or tightening that whole lower lid region. That can be done with peels, lasers, etc. The other reason I don't like to remove much, if any, skin here during the surgery is that also increases your risk of ectropion.